it's going to take all of us working together. Even if we're not in the field of healthcare, it's caring for people and making sure that they're getting access to healthcare. And so there's a lot of different entities that can play a part in that process.
Welcome to the Golden Group Strategic Growth Podcast, featuring expert insights, interviews with thought leaders, and business plan triage. Hosted by Kyle Golding, award-winning entrepreneur, CEO, and Chief Strategic Idealist for the Golden Group.
Hello, everyone, and welcome to the Strategic Growth Podcast. I'm your host, Kyle Golding. I am joined today by special guest, Jeanean Yanish Jones, the CEO, along with a bunch of other titles of the Health Alliance for the Uninsured. Introduce yourself quickly.
Sure. Thank you, Kyle. I'm happy to be here today. And as you said, I lead an organization that helps support the free and charitable clinics in the state of Oklahoma and primarily serving, of course, our uninsured population.
You have several certifications after your name. That's what I meant by
certifications.
So
okay.
what are some of the certifications that you have?
Sure. So I've been in a nonprofit work for a long time. So I'm a certified fundraising executive for many years and helped with a variety of projects, including at Oklahoma Christian School, working on capital campaigns and annual funds and special events and auctions, and then Salvation Army, working with them, helping to build buildings and doing angel tree and bell ringing and fan drives and coat drives, all the things. And then now, of course, I get to be leading an organization, still doing quite a bit of fundraising as well. Any nonprofit, we need to have the funding to be able to do the great work that we do. So, and I have a master's degree and also some doctorate work that I've done, and developing also a curriculum called Live, Love, Laugh Leadership Curriculum. And then also a new acronym that I have is called DG. So I'm district governor for District 5750 for Rotary International. So getting to go out and visit clubs and also tell about the great work that they're doing, in addition to supporting the free clinics across the state while I'm out traveling.
A lot of amazing background, education experience that you're bringing to Health Alliance for the Uninsured right now.
Thank you.
The organization has been on quite a track since you've taken over. How long have you been the executive director?
This month was my 4-year anniversary.
There you go, 4 years. 4 years, very successful. But right now, Health Alliance for the Uninsured is involved right in the middle of this big process that the state and triggered by the federal government, the
Correct.
Medicaid re-enrollment, because of the ending of the public health crisis that was triggered by the COVID-19 scenario, right? So
that's correct.
And a lot of what you're doing, and a lot of what we do in helping you in that work, is letting people know that they might have to re-enroll or change their opportunity to have Medicaid coverage. Right. And employers need to know that as well, because sometimes it's through employment and sometimes it's through the state sooner care, et cetera. Talk quick right to employers about what they need to know about how their employees might be affected by this transition. It's a whole long transition period, and what they need to do to help their employees make sure they stay with their health insurance.
Sure. So, and of course, a lot of employers, we have all levels, mid-range, working class individuals. So you may have employees or employee family members who take advantage of and get the opportunity to be on Sooner Care or Medicaid. It's the same thing. We call it Sooner Care in Oklahoma. It's our public health or public insurance program. With the re-enrollment, that people were held on longer without having to be disqualified due to, just like you said, with the continuation of the public health emergency that has now expired. So they're getting letters in the mail saying you need to re-enroll. Employers need to know this because it's impacting families and people that they know, maybe their employees or their employees' family members. And the number is astonishing because we already have over 600,000 uninsured, and now we're adding an additional 308,000 by the end of the year. So this is almost a quarter of our population. Right. So all of us are going to know somebody that's being affected by this. I think the thing that's really important, and you touched on this with timing, is take action. Like when they get the letter that says, you need to re-enroll, this letter had gone out before. There'd been communication about this before when there was the extension. So sometimes it's kind of like crying wolf, right? They're like, oh, I had that before, and right. it worked out. Well, this time, no, you really take action because there's only some windows of opportunity. Like, so if you are an employer and you allow your employees to go on your plan, you'll have a special enrollment period for people who are losing their Medicaid sooner care coverage to join your health plan if that's a choice that they choose. Your HR or business team also will want to know, well, if that's not an option for them, what are some other options for them? And so they could go on a marketplace plan, healthcare.gov. If that's kind of confusing for them, there's organizations like Legal Aid of Oklahoma that can help navigate people through that and make sure they're making a good choice. They're doctors in the network. It's a plan that's going to work for them. It's affordable. They may also be eligible for other benefits that they didn't know about. Maybe they have tribal health and they've never accessed a tribal clinic that could be a free healthcare source for them, or if they've had military service and veterans benefits. There's also federally qualified health centers that people can go to and get health care on a sliding scale. So maybe they're like, well, I'm just going to kind of take a little risk and not try to get insured, but I do need to get maintained. I have a chronic health condition. I want to be able to have that continuity of care. The biggest concern here is people going without health care when they need it, especially.
Right.
And Kaiser Family Foundation estimates that most people, when they lose their health care access or coverage, it's 9 to 12 months before they get reconnected. And regardless of any kind of income level or whatever, it's just that's the national average. So we really want to beat that average. We want people to take action, see, okay, what are my options, and get connected. We already have some pretty poor health outcomes in our state. So we have the opportunity, the more that we know that this is happening, and encouraging our friends and loved ones and employees to, hey, maybe you could do this, or call our office. We can help navigate people.
That's the main bit of information I want everyone to take away from this, because it all sounds maybe very confusing and overwhelming and sounds like a huge project, is the Health Alliance for the Uninsured, along with other community partners like Legal Aid. Your job is to help people figure this out.
Right. Find what's going to be the best option for them.
And navigate through the system, because you have experts who understand all of the options that most of us laymen don't know.
Right. I like how you say that.
And as we talk to employers and business leaders, it's important for us to keep our employees healthy.
True.
So that access to healthcare is so essential for business and for our people.
Yes, that is a huge point. And there's a huge ripple effect for unhealthiness in our families, in our workplaces, our overall state economy. There's an economic impact to that, having people that are unhealthy, unable to work, unable to participate in life in a meaningful way.
Be part of the community, part of everything that that involves a full, fruitful life for our people, right?
Right. Well, and we all know, when we're under the weather, we're calling in sick. We're not able to do things. We're canceling, and we just miss out. Life is passing us by. And
some people maybe even will go to work ill because they don't feel like they could take the time off or go see a doctor, and maybe they're bringing the flu or something else to work and spreading it through the workplace as well. So we want. We as employers, we don't want any of that to happen. We want people to get the care that they need as quick as possible. Right.
And I think that we're, in general, as a society, moving towards a more holistic approach to well-being. We can't be compartmentalized. We have, we're talking about, our mental health and physical health, all of that. And I think employers are becoming more and more conscious of self-care and helping address the whole person. And some examples are, we have, some flexible scheduling now. Workplaces will let people do a hybrid schedule to be able to accommodate things that maybe they need to be at home for, but they can still be a productive employee working in a hybrid schedule. And things like that contribute to people's health.
The common phrase is work-life balance. We like to call it on this podcast, Pritch brought this up, he coined this phrase, work-life integration. They should work together, right? We don't live to work, but some people need to work to live. Right. But integration, and they kind of go hand in hand. And when you have a good employer and good employee relationships, we do take care of our mental health, physical health, and all of those other aspects of work-life integration.
Right. I love that. Yeah, being integrated.
Now, you have a very good, loyal, happy staff. I talk to your staff on a regular basis. Because we work together, your people enjoy working with you and working for you. what are some of your philosophies on building staff, corporate culture? Like, what are some of the things that you bring to an organization that you feel benefits the people that work with you and for you?
So I think it's connection. It's meeting with people. I have, we've all done a lot of leadership training and those one-on-one meetings, checking in, hearing how everybody's doing, and then also being mission focused at the same time. Yeah. So making sure that we're not only thinking about work, but we're thinking about the person and integrating. I like your word, integrating, and making sure that we're helping each person reach their highest potential. Mm-hmm. And their goals. Like, what are your personal goals in this role? What are some things, some training that we could bring to you, or some aids, anything that could help you to be more productive and fulfilled in the work that you're doing?
And how do you think your nonprofit experience, being an employee now in leadership role, and then your higher education experience, your educational pursuits, and even things like what you learned through Rotary, how do you kind of take all of these ways of learning and incorporate that into a leadership style?
Well, I think you hit on something that's really important, and that's about being a lifelong learner. And so I know that I still have a lot to learn. And so in every situation, I want to be able to, help me understand this better. And then how can we, what is the problem? What is the solution? How can we work together to get to the goal that we're trying to achieve? And everybody's on the same page with that. I think in leadership, I love the most basic example. If you're a leader and you turn around and there's no one behind you, you're not really a leader.
You're leading, right? You have to have people to lead to be a leader. Yes,
that's right. So making sure that we're building consensus and buy-in, and that we're all kind of supercharged about and passionate about the work that we're doing together. And I say work professionally, but also the work that we're doing to help have healthy families, have a healthy body, make healthy choices, providing a workplace environment. Like you said, that happy part, that's priceless in a workplace where we have a staff meeting where we have quite a few giggles in the staff meeting, but we're still, we're on point with the work that we need to get done, but we can really enjoy it too and feel rewarded by it, and also celebrating the successes.
I'm glad you said that word, reward, because the question I had percolating in my head is the rewardingness, the feeling that people get when they work for organizations like the Health Alliance for the Uninsured, and your background too with some of the other nonprofits you've worked with. When you talk to people who work in your industry and they do the work they do, also even the physicians and other professionals who volunteer their time at the free clinics and things that services that Health Alliance for the Uninsured provides.
Sure.
Is there a common theme or a common feeling or that those people get when they feel like that they're doing rewarding work?
Oh, sure. Yeah. I know that there is that. Well, and you get the feedback, they have instant gratification from the patients and clients that are like, oh my gosh, I'm so grateful that I found this, or that you're helping me in this area. So I think, and that's even in Rotary too, our motto is service above self. Right. And it's a giving opportunity, but it's also selfish because it is rewarding and it feels so good to do that. And I know you, Kyle, that's your life motto too. You're a giver, but it feels great to do it. Absolutely. And so you create this snowball effect of like, well, what else can I do? Because there's a lot of need, and we're all trying to make that, that one starfish at a time difference. Right.
That's why I like to have these encouraging stories on the podcast. There's a lot of conversation we have here that's very, very business, very, numbers and the P&Ls and all of that good stuff, which is awesome. And I like that part too. But the human part is essential too, right? How we stay motivated, how we find our reward in it, how we stay integrated, et cetera. And if happy employees make for very productive employees.
Sure, yes.
Now, the Health Alliance for the Uninsured has been expanding. Originally started to serve Oklahoma County.
Right.
But now you serve the entire state of Oklahoma.
Yes.
That's a big jump in numbers and obviously geographically as well. So how have you managed this process, and what are some of the things that you thought maybe were going to be easier than they were, or things that were going to be harder than they really were?
Sure. So I think it's really responding to the need and listening and connected. That's one of the strengths we have in Oklahoma is the relationships that we have with each other. And we're a United Way partner agency. I know you have a history and background with United Way, so you know the important work that they do and how great they are at connecting partnerships. Right. And so we need to stay centered on our mission. We can't be all things to all people.
True.
But we can do a lot in our lane. Mm-hmm. And then as we partner alongside other organizations, what is all waters raise.
Yeah, the rising tide lifts all boats.
That's right. And so the Health License for the Uninsured, we started as just one program, our specialty care referrals, which is a huge need, and the hospitals really needed that for us to help because people were presenting in the emergency departments because they weren't they were getting in a health crisis because they weren't managing their health, especially a lot of chronic health conditions. So the Health Alliance for the Uninsured came alongside and tried to help the free clinics to provide a higher level of service so that people could stay healthy and maintain that health with a free clinic as their primary care home. And also it gave the specialists an opportunity to get engaged as volunteers and give back because the medical professionals, they're wired to be a giving and healing heart.
Yes.
And so this really speaks to them too, because there's things you have to do, and they're doing healing to, to provide for their families and to help people, but they also get to have that opportunity to have the reward of giving back in that meaningful way. And so as we started working with the free clinics on the specialty care, then we continued to discover more needs that the free clinics had and the population that we were trying to serve had. So that's, and then as funders saw the effectiveness of the model that we were creating, starting with the specialty care program and then expanding to medication assistance, then we added our navigation department, the healthcare services navigation, to help people get connected. So we were helping them once they were connected, helping get connected, helping get them the prescription assistance. Then we added an uninsured diabetic program, thanks to the United Health Foundation. So then we could add additional resources through this. So we really have this hub and spoke model where we're kind of this hub providing services out to the free clinics as a conduit to reach as many people as possible. And then we're asking the free clinics, what else do you need to increase your capacity or your effectiveness? How can we help you that way? And that speaks to our fifth program, which is how we are a resource to the free clinics. We house the Oklahoma Charitable Clinic Association at our office, so we're connected to our national association. And so as we continue to provide these services and training and resources, we were able to expand beyond Oklahoma County to serve the whole state. We keep a master database of all the free clinics, so we stay connected with them. And then now kind of our big next project going forward is really working with the free clinics on helping them to quantify and share the amazing impact that they're making at the free clinics through data and data analysis and storytelling. So,
which has amazing impact when you can take real world information that's really happening and put it in a story form that people can easily digest. The understanding of the need for the Health Alliance for the Uninsured, the support for it, other doctors to volunteer their time, etc. You said snowball area. It begins a snowball effect, right? Where more and more people are doing good work for people who need it.
Right. Well, and I have this illustration that I love, and I use this a lot when I'm describing, the value of data to the free clinics. And it's very simplistic, but I think it's powerful because it starts out with a pile of multicolored Legos. Then you sort the Legos by color. Then you stack them together. So you have the bar looks like a bar chart. But then the ultimate goal is you build this beautiful house and tree and scene with all those Legos. So it goes from just a dump of raw data to this beautiful illustration of how this data provided this outcome.
You also do a lot of convening and collaborating. You bring a lot of organizations together, whether they're organizations you work with all the time or just needed in a case like this with the re-enrollment of the Medicaid because of the situation that's caused. What's your philosophy and approach to bringing together organizations. Sometimes they're already collaborating. Sometimes maybe they think of each other as competition, but you have to put them together for the common good. What are some of the approaches you have to that?
That's a great point. And that's nice of you to give that compliment too, because it's really something that I love doing that, because we're finding each other's strengths, the different organizations. And then, and like I said, we have one mission, so we can't be all things, but this group can do this. A huge part of healthcare right now is addressing social needs. They call it, social determinants of health. So you have the doctor's appointment, but how's the person getting to the doctor's appointment? And how are they getting healthy food? And what about childcare? And do they have any other needs that we need to maybe address so that they can stay healthy beyond just a 30-minute appointment with the physician? And this with the Medicaid situation right now, with the public health emergency expiring, it's going to take all of us working together, even if we're not in the field of healthcare.
Right.
It's caring for people and making sure that they're getting access to healthcare. And so there's a lot of different entities that can play a part in that process,
including private business, employers, et cetera. That's why it was so important to have you on the podcast to have this conversation. I want my business people to understand that healthy employees, healthy citizens are beneficial to the entire system.
Right. Well, and then that even loops back to having a healthy, effective workforce.
Right.
Because because you're having conversations with your team. And so if you're talking to them and coming alongside what they're doing and things that are concerning them, and they mention to you, hey, I got this letter in the mail. Now oh, okay, there's some process. You need to take action. What were the suggestions on there? Of course, on the letter, it says, first thing you need to do is go online. We're really fortunate. Oklahoma is one of the only states that has an instant eligibility online. So when you go to the Sooner Care website and do your re-enrollment, it'll tell you right then if you're eligible or not, or if you've become over income. And then it has a landing page that says, okay, you're not eligible. You might want to try to get a marketplace plan. You might check with your employer. You might call the free clinic, the navigation team at Health Alliance for the Uninsured. We're working with the Unite Us platform, so we're able to refer interagency through that great tool.
So don't be afraid if you have to go through this process. Get into the process, and then if you need help, there's resources for you.
And we call it the white gloved approach.
Oh.
Because
sounds very fancy.
It's very fancy because it takes time to work one at a time with somebody, and just because everybody's situation is unique. So nothing is one size fit all. And then also, same with the clinics. We have, they're autonomous as well, over 90 clinics, and they all have a unique perspective. So we need to look with the lens of health equity on, whether, well, of course, the geographic, but maybe there's a language need or things like that. And so we want to make sure that it's going to be the best fit for that individual as well.
Now, you mentioned earlier in your introduction that you developed a leadership system. Let's talk about that a little bit. Leadership is essential for everyone.
Right.
Business, nonprofit, and in civic leadership as well. So what are some of the core tenets and philosophies behind your leadership system?
Well, the most important one, and the tool that I found to be the most accessible, easiest to access, is gratitude.
Okay, that's great. Perfect.
Because we just forget to do that.
Right.
And what are we thankful for? And there's science behind this. Dr. Krishna, our founder for Health Alliance for the Uninsured, works with a lot of motivating and inspiring and teaching and leading and mindfulness and gratefulness, and especially for healthcare professionals, where especially during the pandemic, there was a lot of burnout.
Sure. And
he said if we thought of 3 things we're grateful every night before we go to bed, in 2 weeks, we would have an improved outlook, science-based.
Okay.
So that's a challenge.
Sounds easy enough to do, to start.
Right.
Got to be consistent.
And
then apply it to what you do professionally.
Right. And then like the Live, Love, Laugh leadership curriculum, basically I set it up as a 30-day, and there's all the, habit, James Cleary, how to create healthy habits. And it was just introducing one new idea for overall well-being a day. We do one, just introduce one thing a day. And so that's how I had that set up too.
Very interesting.
So simple things like might just be drink some more water.
I'm bad at that one. I don't drink
Really?
enough water.
Oh, so good for you.
In general, I try to, but
I know. And now they have all the tools, right? There's the big jugs, 8 a.m., 10 a.m.
I've got the app that tells me if I've had enough calories each day. And
Okay.
I get good
Tracking.
at it.
Tracking is the key to success.
Consistency.
That's
Consistency is the key to success. So that
consistency
makes
and
sense.
tracking. Yes, because if we're not keeping track of it, we're, what you don't, how's that go? What you don't measure, you can't evaluate.
Right. And if you can't evaluate it, you can't do more of what works and do less of what doesn't.
That's right. Yeah.
So what are your plans you were just newly named a district governor for Rotary. What are your plans for that position?
Well, this is really an exciting opportunity, and it's unique. There's been multiple, but they've after you fulfill your role as a district governor, you become a past district governor. So there's really an amazing group of past district governors in Oklahoma that I've just been getting the honor to get to know. And everyone has a different leadership style. It's a volunteer leadership role with a volunteer organization that actually you pay for to be a part of it and work.
Right.
But what an amazing organization. Rotary International is worldwide, 1.4 million members. And it's also in the nonprofit sector. Rotary International has the highest rating by Charity Navigator for the last 11 years.
Okay.
Doing great work. The biggest accomplishment of Rotary is the eradication of polio. Mm-hmm. So there's 4 active cases as of about 3 weeks ago left in the world. So that's huge. I think one of the most meaningful thing about being part of Rotary are the connections. And you talked about the convening and the importance of bringing people together, even sometimes when they don't, some may see it as competition, but realizing that we're all working towards a common good. Mm-hmm. And there are so many stories of people that are in Rotary that were able to accomplish something they never thought they would be able to just from relationships that they had. Or you think, oh, I wanted to try and do XYZ, or I'm needing this thing. And they're like, oh, I know so-and-so, or I know so-and-so. And there's so much value and wealth in the relationships that we have and the people that we know. For example, I feel that way about you, Kyle. You have been an amazing part of Health Alliance for the Uninsured in helping us grow. Right. Because we can't grow without awareness. Mm-hmm. And you have brought expertise and branding beyond, they say, well, we need to do social media. Let's hire a 20-year-old because they know how to post things. But it's like you need wisdom plus and that strategy. So you can't just because you know how to put a picture on Instagram, that doesn't make you a social media expert. What makes you a social media expert is what you do with really framing us as a really important organization, providing important service within in a really well done format. We both have a high level of professionalism mm-hmm. that we seek in the image and that we're portraying. Right. And that's important for the clients that we serve, that they view us as a professional organization, but also for the partners that we have that are helping support us along this route.
But we're also lifelong learners.
That's right.
Continually trying to get better every day, right?
Well, and then all of that awareness and tools that we have continue to evolve as well. So now we have AI and all these things that could just do it all for us. And we could just stay home, bonbons, soap operas.
I don't think it's ever going to be quite that easy.
No, I don't either. Well, I don't think that would be fulfilling no. Because that's part of that that loop.
Yes.
The feedback loop of doing meaningful things and making a difference. Like we have a purpose here, and we don't want to miss that opportunity.
That is so perfect. I'm going to end there.
Okay.
I don't think there's a better way to end the conversation. Thank you so much, Jeannie, for being on the podcast and having a conversation about your background and various ways that you've come about leadership and how you're putting it into play. And then, of course, the conversation that all employers need to know and citizens need to know about how to keep themselves healthy by making sure they stay covered, and the work-life integration that comes along with it.
Thank you.
So thank you so much for being on the podcast today.
Thank you, Kyle. Thank you for having me.
Thank you for listening to the Golden Group Strategic Growth Podcast. Please subscribe so you never miss an episode. Follow the Golden Group on social media. For more information, past episodes, or to contact us, please visit thegoldengroup.com.